Are going live. George, do I need to make you host?
Yes, please.
Okay. And if you can make me co-host.
Yeah. Okay. Captioner, would you mind just doing a test to make sure that we're getting that on YouTube, please? It's in the chat. Yes, it's the same link.
Okay, so there's a PowerPoint on showing live now.
Okay.
Is that good? Okay. Well, I mean, it's not in slide mode. It's just. I'm waiting. Yeah, let me see. Yep, captions are coming through.
Okay, great.
We are good to go.
Okay, so I'll start recording. Good morning, everybody. Good morning, everybody. As this is the quarterly meeting of the Virginia Public Guardian and Conservator Advisory Board. We will be starting momentarily. Please be aware that this meeting is being live streamed via the DAR's YouTube page, and it's being recorded, so your image and voice may be captured. Good morning for everybody who's just joined us. This is the quarterly meeting of the Public Guardian and Conservator Advisory Board. We're just waiting for Rose Palmer, our chair. We'll give her a couple more minutes. But I want to let everybody know that we are live streaming to YouTube, and the meeting is being recorded. Okay, so Rose Palmer has joined us. We have a quorum. I'm going to do. Good morning. So I'm going to do some housekeeping announcements, and then I'll turn it over to, and then a roll call for attendance, and then I'll turn it over to our chair, Rose Palmer. As I said, this is the quarterly meeting of the Public Guardian and Conservator Advisory Board. Due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via a roll call of voting members. Meeting materials are posted under the Virginia Public Guardian and Conservator Advisory Board quarterly meeting tab on the DAR's Boards and Councils webpage. Members of the public are able to live stream this meeting via the DAR's YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored. A public comment will be accepted by email or phone to my attention. Public comments that were received by March 15th, 2021 will be read, or if lengthy, summarized during the meeting when we reach that agenda item. I'm going to skip going through the Zoom functions since I believe everybody's probably up to speed with Zoom by now, unless anybody would like me to. I will ask that when you speak, please identify yourself. This helps the captioner capture who is speaking, and it also helps help Cecily Slacer with documenting the minutes. And it's particularly important as we will be discussing recommendations, and the captioner will be trying to caption the discussion. Please only use the chat feature if you have a technical issue or other issue not related to the business of this meeting. Chat comments are not captured in the live stream or the recording, and so are not available to members of the public. So I'll do a roll call now to confirm your attendance. So please unmute yourself and say yes or present. James Almond.
Present.
Betty Doherty.
Present.
Susan Elmore.
Present.
Kathy Harkey.
Present.
Angela Harville or Kimberly King.
Present. This is Kim.
Thanks. Monica Karavanich. George McAndrews.
Present.
Rose Palmer.
Present.
Angie Phelan.
Present.
Lindsay Pickrell.
Present.
Tara Ragland. I know she just joined us.
Here.
Okay. Wasn't sure if you connected to audio yet. Latoya Roxburgh.
Here.
Ming Truong.
Present.
Erica Wood.
Present.
Christy Zed.
Present.
Okay, so Rose, I'll confirm a quorum is present. And if you'd like to go ahead and start the meeting, I'll pull up the agenda.
Good morning, everyone. I'm glad everyone could join us electronically. One of these days we'll get to see each other in person again. Today we have a lot going on. I just want to welcome everyone and let each of you introduce yourselves. I'll start if you want. I'm Rose Palmer. I'm an attorney in the area. I am a member at large, and I am currently the chair of the board. And Patty.
I'm Patty Meir, and I am the coordinator for the Virginia Public Guardian Program, and I work here at DARS.
Rose, if you like, I can call people. Okay. You're muted. I think you said okay. So I'll just go alphabetically through the members and then guests. James Almond.
I'm a retired circuit court judge from Arlington, and I'm here in that capacity.
Thank you. Betty Doherty.
Hi, I'm Betty Doherty. I'm the Director of King and Queen Social Services, and I represent the Virginia League of Social Services Executives.
Susan Elmore.
Hi, good morning. I'm a healthcare management administrator, and I am a member at large.
Kathy Harkey.
Good morning. I'm Kathy Harkey. I'm the Executive Director of NAMI Virginia, which is the National Alliance on Mental Illness.
Thank you. Kimberly King.
Good morning. I'm Kimberly King. I'm a Community Integration Manager, and I'm representing DBHDS.
George McAndrews.
I'm George McAndrews. I'm an Assistant City Attorney in Alexandria, a Fairfax County resident. I believe I'm a citizen at large member.
Angie Phelan.
Angie Phelan, and I'm representing the Virginia Area Agencies on Aging.
Lindsay Pickrell.
Hi, I'm Lindsay Pickrell. I am here in Midlothian, Virginia, and representing the Virginia State Bar.
Tara Ragland.
Good morning. I'm Tara Ragland. I am the Division of Licensing, the Director for the Division of Licensing Programs at the Department of Social Services.
LaTroy Roxburgh.
Good morning. My name is LaTroy Roxburgh. I'm a licensed clinical social worker, and I have a private practice in the Richmond area. I'm a member of the board and also a secretary. A real new secretary.
Mm-hmm.
Thank you. Ming Truong.
Good morning, everyone. Again, Ming Truong. I am a member at large. My background is electrical engineer and energy program manager for the Navy, but nothing to do with the Navy at this time. That's my paid job. In my non-paid job, I'm director of senior club down here in Norfolk. So thank you so much for all the support.
Thanks. Excuse me, Erica Wood.
Hi, I'm Erica Wood, and I'm here in Arlington, and I am representing the Commonwealth Council on Aging.
Christy Zed.
Good morning. I'm the Chief Operating Officer of Developmental Services at Richmond Behavioral Health Authority, and I'm representing the Virginia Community Services Boards. And I'm also, like LaTroy said, I am a very new vice chair.
Thank you. And Monica Karavanek, I saw you came in.
Hi, good morning. Sorry, I was late getting on. My name is Monica Karavanek, and I'm Director of Operations with the ARC of Southside in Danville, Virginia, and I hold the seat for the representative of the ARC of Virginia.
Thanks. Excuse me, and guests, Marcia Dubois.
Good morning. I'm Marcia Dubois, Deputy Commissioner for the Division for Community Living here at DARS.
Kathy Miller.
Good morning. I'm Kathy Miller. I'm the Director of Aging Programs and Services here at DARS.
Betty Vines.
Good morning. I'm Betty Vines. I'm a program specialist with the Public Guardian Program here at DARS.
Charlotte Arbogast.
Hi, good morning. I'm Charlotte Arbogast. I'm a policy analyst and the regulatory coordinator at DARS.
And John Carpenter.
Good morning, everyone. My name is John Carpenter. I am new to DARS. I am the Director of Administration for the Division of Community Living, and it's a pleasure to be here with you today.
Thanks. And I'm George Worthington. I'm the Dementia Services Coordinator at DARS and the staff to the board. Did I miss anybody out? I believe I got everybody. Okay.
Cecily?
So I'll turn it back to you. I'm sorry?
Cecily, maybe?
Cecily doesn't usually connect audio.
Okay.
I will introduce Cecily is Slacer, our administrative assistant, and is taking the minutes for the board. Thank you. And I'll turn it back to you, Rose.
Thank you. Okay, at this point, we need to approve the agenda for this meeting. Does anyone have anything new to add to the meeting, or? No, I think the agenda is on the screen at the moment. If there's nothing to add at this point, can we get a motion to approve?
Jim Allman moves to approve the agenda.
George McAndrews, second.
Who was the second?
George McAndrews.
Okay. Thank you. And at this time,
I'll do a roll call.
Thank you.
Please say yay or nay, or you may abstain. James Almond. Betty Doherty.
Yay.
Susan Elmore.
Yay.
Kathy Harkey.
Did you hear yay?
There
you go.
Here, no, thank you. Kimberly King.
Yay.
Monica Karavanik.
Yay.
George McAndrews.
Yes.
Rose Palmer.
Yay.
Angie Phelan.
Yay.
Lindsay Pickrell.
Yay.
Tara Ragland.
Yay.
Latoya Roxburgh.
Yay.
Ming Trung.
Yay.
Erica Wood.
Yay.
Christy Zed.
Yay.
The A's have it. The agenda is adopted as presented.
Thank you, George. The next thing on our agenda is to review and approve the minutes from our November 19th, 2020 meeting, which was our last meeting last year. I think there had been a mistake previously. A September 8 date was on there, but I think it's been corrected. You can take a minute or two to review them now if you haven't already. And then if there's any corrections or changes, please let us know. I'm sorry, are there any changes?
Excuse me, Rose, I'm not a member of the board, but I should have given this to George earlier. It says that I gave the public the update for the public guardianship program in November. And actually that was given by Betty Vines, our program specialist.
That's right. We missed you.
Thanks, Patty. I'll update that.
Any other changes, comments? If not, the minutes are adopted as presented. George, were there any public comments prior to today's meeting?
No, Rose, we didn't receive any public comment.
Okay. Now we have the Division for Community Living report with Marcia Dubois.
Well, good morning, everyone. I'd like to start off by just sharing that DARS is still mourning the recent loss of our former commissioner, Jim Rothrock. Jim served as the commissioner for DARS for 16 years, which is the longest term of any commissioner. And for those of you who are fortunate enough to know him, you know that he was well known not only for his leadership, but for his warmth and his sense of humor and his charisma. And he was known not only here at DARS, but just throughout the Commonwealth for his tireless advocacy for people with disabilities and older adults. And that advocacy extends for many, many years. In fact, he was instrumental in getting the Virginians with Disabilities Act passed, which passed 5 years before the Americans with Disabilities Act. So you all may have noticed many tributes in not only the Richmond Times-Dispatch, but many other newspaper articles. And, you know, the whole DARS family is just really still reeling from this news. So I just wanted to acknowledge that for all of you that we're still mourning that loss, and know for many of you who may have encountered him in your paths, you may be as well. Also wanted to share with you all some specific updates from the relief package, the American Rescue Plan. Most of you are familiar with some of the more common elements of benefits to individuals for vaccine relief, but there were also some aspects of the American Rescue Plan that will benefit older adults and others through programs that we provide. And so I just wanted to highlight some of those for you. We haven't received the funding yet, but we do expect to shortly. There will be new money coming for congregate and home delivered nutrition services, Native American nutrition, supportive and caregiver services, also what we call Title IIIB supportive services, long-term care ombuds program, evidence-based health promotion and disease prevention services, caregiver services, elder justice services, National Senior Service Corps. There will be an increase to the federal medical assistance percentage for home and community-based services. There will be increases in funding for infection control efforts in nursing homes. There will be the money for the establishment of strike force teams that can address resident and staff infections in nursing homes. Just wanted to share that with you all. I thought that you all would be interested in knowing that. In addition to that, I know that some weeks ago, George had sent out updates on some of the items in the General Assembly. And I just wanted to give you an update from the conference report of some of those items and just highlight just a few of them. You know, we've got a packed agenda here, but There were increases in Medicaid rates for personal and respite and companion care. Those rates for personal care and respite care were increased for waiver programs by 6.4% that will go into effect May 1st, and then an increase of up to 12.5% effective November 1st. And then also on Medicaid, there is an amendment that adds language requiring DMAS to research and report on the cost and program changes which would be necessary to allow SSI recipients to become automatically enrolled in the Medicaid program. In addition, there was an amendment to restore $425,000 for the second year to Centers for Independent Living. In addition to that, there was another budget amendment for brain injury programs for $1.2 million in the second year. In addition, there was an amendment to create a work group with the intent that aging services be elevated in importance within state government to include consideration of optimal organizational structures, including a new agency for aging services, adult protective services, and other aging related programs within Health and Human Resources Secretariat. We've got a lot of work to do, and of course, we're fully engaged in this process. In addition, there was another amendment that adds $50,000 for the second year from the general fund for demographic services for statewide aging services at the Department for Aging and Rehabilitative Services, that's us. There was also an amendment that provided $4.4 million from the general fund for the second year to increase the auxiliary grant rate by 10% or $142 on July 1st. There was another amendment to modify language in the introduced budget related to the creation of a work group to make recommendations on dementia services to divert and discharge individuals from state behavioral health hospitals. And that language will require the work group to look at the Northern Virginia Regional Older Adult Facilities Mental Health Support Team, or RAFT, model to determine the feasibility of replicating that model. And then finally, there's an amendment to restore funding to provide interdisciplinary plan of care and dementia management for 50 Virginia residents diagnosed with dementia. This had been approved and then removed. This would fund $150,000 each year of the biennium for a partnership with the Memory and Aging Care Clinic at the University of Virginia and the Alzheimer's Association. So that's it for the legislative highlights. Also wanted to mention that DARS has applied for 2 falls prevention grants and a grand driver grant in recent months. We're ready to apply for a lifespan respite grant. We've got it all set to go. We expect that grant to drop from ACL momentarily. And we're also researching a HUD grant that might allow us to help programs apply for or have funding for housing modifications. So we're excited about that. Then my final announcement, just wanted to remind you all that the Virginia Association of Area Agencies on Aging and DARS have decided to pivot the 2021 Governor's Conference on Aging to a virtual format. And that conference will be held the week of May 24th. So we hope that you all can participate. And that's it for my announcement. Thank you.
Rose, you're muted.
I keep forgetting to unmute. I apologize. Thank you so much, Marcia. I appreciate your report and all your work on this. And I appreciate your tribute to the former commissioner. I've met him a couple of times and found him to be an extremely knowledgeable man and very kind. I was glad that I got to know him a little bit, and I know he will be missed by DARS. Okay, moving on. The bylaw revisions were presented at the last meeting. As required, and members have seen them again ahead of today's meeting. George can summarize the key changes of the bylaws and the electronic meeting policy that was added, and that will take effect upon adoption. All executive branch boards and councils are required by FOIA to have an electronic meeting policy now, which will be in effect once the current state of emergency is ended and the temporary authorization for full electronic meetings ends. And I'll turn it over to you, George.
Thanks, Rose. So I'm going to share the proposed new bylaws, and I'm going, since I went through them in quite a bit of detail at the last meeting, so I'm not going to go through in quite as much detail, but please stop me and ask questions as I go through. I'm just going to cover the main changes that were detailed in the summary of changes sheet that you also received. Just as a bit of context, the changes to the bylaws are proposed in order to bring the bylaws into to conform with the Code of Virginia and with FOIA. So there have been changes to FOIA since the current bylaws were adopted in 2015. As Rose mentioned, we are required to have an electronic meeting policy. So that is proposed here as an addendum to the bylaws. I'll just go through section by section, but briefly, mindful that we do have a lot on the agenda today. So sections 1.1 and 1.2, there was no change there. That just describes the board. Section 1.3, the duties and responsibilities of the board. This language was lifted directly from code, so we know it's conforming. That's section 51.5-149.2, which is the section of code that details the Public Guardian and Conservator Advisory Board and its duties and responsibilities. Article 2, membership, really just made this a little bit more legible and clear, so it's easy to understand where the members are coming from and who they represent. The various representatives of different organizations and the at-large members.
George, can I ask a question? Yes. The Arc of Virginia, please. It should not be capitalized anymore. ARC, it's no longer ARC. Can that be changed, or is that because it's pulled straight from code?
It is pulled straight from code, so yeah. Is it lowercase now? Is that?
Yeah, you know, ARC used to stand for the Association for Retarded Citizens, and they got rid of that, so it's now just the word ARC.
I see.
The ARC, and it's just a capital
yeah.
A, little r, little c.
Okay, Monica, I'll double check that, but I believe this is how it's presented in code.
I think it is. I just didn't know if that was something that, you know, that could be looked at, just because we really don't want that R in there for what the word that it uses, you know.
Okay.
George.
So actually, yes.
This is Susan Elmore. I have just a technical question on, and I'm sorry, it goes to section 1. We say commissioner, do we need to identify which agency that is, or does the code automatically take it to the agency? And the same question for section 1.3, item E, we say department. do we need to identify DARs? And that's kind of a technical question that I don't know.
So I thought I had, so no, this needs to be defined at first mention. So thank you, Susan. I will define that there.
In section 1.1 where it says commissioner, up above that.
Yeah. Okay. Yep. So I can add that in, Commissioner for the Department for Aging and Rehabilitative Services, and define department there. And I've had advice that we can probably change this in the bylaws. It doesn't need to be exactly as in code, Monica. So. Okay. Section 2.2 did not change. Section 2.3, sorry. Section 2.3 was updated to include DARs providing staff in the recommended language on compensation. Section 2.4 updates the language to include recommended language on absences. So just as a bit of context there, DAR's policy section has worked on developing a template for board and commission bylaws that we're working on as well, working from as well. So much of the language change reflects those changes that we're recommending for all our boards and councils. Section 2.5 is a new section on member responsibilities. So that details that members need to receive information about FOIA and the Virginia Conflict of Interest Act.
George.
Yes.
Go ahead, Susan.
Go ahead, Lindsay. I think we're saying the same thing.
Yeah. This is Lindsay Pickrell. George, I'm sorry to be that person. I just noticed that at the top of subsection B and C there, or B, still has the template language.
Yes, I see that as well. Yeah, so that would be newly appointed members of the board will make every effort to attend a new member, a public guardian and conservator advisory board, new member orientation provided by the department. Sorry. Okay. Article 3. So this details the officers. So proposing to eliminate the position of secretary. So under the code, the board is required to have a chair and a vice chair, but not a secretary. And this would just simplify and streamline not only elections and nominations, but also the operation of the board. Also renaming chairman to chair and vice chairman to vice chair throughout. Section 3.2 added some language around providing for vice chair special elections. Section 3.3 clarifies the purpose, scope, and role of the nominating committee. Section 3.4, there was no material change here. Article 4, the new bylaws eliminate the executive committee, which hadn't met in many years. Section 4.1A changes the composition of the legislative committee from 7 members to 5, including the vice chair, 2 people appointed by the chair and 2 by the membership. There were no other material changes. Section 4.1B, so there was a planning and development committee detailed in the bylaws. That committee had not met for several years either, so I propose eliminating that. Section 4.3 clarifies the task group and special committee appointments and composition to include potentially non-board members.
I have a question. This is Angie. On that section 4.1, it says the exception of the executive committee. Do we eliminate that?
Sorry, 4.1?
4.4, where you were reviewing.
Oh, I see. Yes. Okay. Yes. So, okay, yeah, so that would be eliminated. So it would be all standing committees, special committees, and task groups must submit recommendations.
George, excuse me, this is Rose. I just wanted to ask about the absentee up above, because it stated that the executive committee would review someone who had missed more than 2 meetings and make a determination. I think since the executive committee is going away, that needs to be rewarded by the board will review, or
sorry, Rose, which section are you?
I keep wanting to move it on my screen. The section where we're talking about members, I think it has to do with new members and members at large, and we're talking about duties of the members and responsibility.
Oh yeah, okay, here, yeah, sorry, yes.
Looks like 2.4 C and D.
Yep.
Yeah.
So that should be changed to the board as a whole, or a special committee would be appointed, or what would we do?
So in the other board that I staff, it's reviewed by the chair.
Okay, we can do that if no one else has a complaint.
And then the chair may advise the commissioner.
I apologize for not catching it earlier, but I've forgotten that.
No, that's all right. This is why we do it twice. Okay. All right, moving back. Thank you for catching this. Okay, Article 5 is on meetings. Section 5.1 included language to clarify the annual meeting, which would be the meeting immediately prior to the end of the fiscal year, so typically our June meeting. included additional language to reflect updates to FOIA and included recommended language on public comment. I'll capitalize that. Section 5.2, special meetings. Recommend changing from 25% of the members to a majority of the members, in line with our other boards and councils. Section 5.3, the quorum. So the previous bylaws had the quorum set at 7, but it's actually in code as 5. So bringing this into conformity with the code. Section 5.4, there was no change. Section 5.5, remove the role of secretary as pertaining to the minutes. Section 5.6, notice of board meetings, updated the language. And section 5.7 incorporates the electronic meeting policy, which is in conformity with FOIA. Section 6, Article 6, Section 6.1 just clarifies the amendment procedures, so that with the old Article 7. And then the last 3 pages are the electronic meeting policy, which I'm not going to go through in detail, but this will clarify how members are allowed to participate electronically when meetings are being held in person. So there's a number of edits that I'm going to make in response to your comments. Rose, I don't know if you'd like to postpone voting on the bylaws until the next meeting, or if you, or we want to propose that they're adopted with the edits.
I agree, George.
Agree with
the waiting to approve the bylaws until the changes are made.
Okay, so I'll make those changes and we'll revisit that in June. All right, thanks everybody for your feedback on those.
That brings us to the public guardianship program updates with Betty Vines. Betty, are you available?
Good morning. Yes, Rose, thank you. My name is Betty Vines, and I'm going to provide the data on our numbers for you all, beginning with our client data. We, of course, have 1,049 client slots. And what I will be reporting is as of the last fiscal year report, which was as of December 31st, 2020, which was our second quarter state fiscal year 2021 numbers. Reports from our local public guardian providers have revealed the following information. We had 981 active clients with a court order establishing our programs as a public guardian. We had 46 offers outstanding to individuals who have been accepted for public guardianship, but still required a court order to begin the guardianship. We had 22 open slots. 19 of these were unrestricted. We had 0 DBHDS ID open slots, and we had 3 DBHDS mental health open slots. At the end of state fiscal year, the second quarter of state fiscal year 2021, there were enough individuals on the unrestricted waiting list and the DBHDS ID DD waiting list to fill all of the open slots in these categories. During the second quarter, there were 20 court orders that were entered appointing a public guardian, and 33 public guardian deaths were reported. COVID numbers have started to increase. As of March 15th, so this is more recent, there were 147 of the Public Guardian Program clients that received a positive diagnosis. And these were people that were actively showing symptoms. Of these, 118 have recovered and 16 have passed. The other numbers have not come in for the remaining folks, so they may, of course, still be going through their positive diagnosis. 68 clients received a positive diagnosis, but they were asymptomatic. So these 68 folks did not show any symptoms. Of these 68, 65 recovered and 3 passed. We also have folks that are retesting again positive. So we've so far have had 3 reports of clients that have retested positive with active symptoms. And of these, we had 1 person that recovered and 1 has passed. And then we've also had 2 clients that have retested positive, but were asymptomatic, of course, not displaying any symptoms. And both of these clients have recovered. And that is all for the data. Do I have any questions about the guardianship slots or the COVID numbers that I just reported? Thank you.
Thank you, Betty. We appreciate your time and efforts. The Public Guardian Program Contract Revision Overview with Patty Meir. Patty?
Before I jump into this, Rose, I just noticed that the my agenda calls for Charlotte's regulatory update. I don't know
I'm so sorry, Charlotte. I missed you. I forgot. I apologize, Charlotte.
Mine won't take long, and then Patty can get into her program. Thank you all for having me today. I'm going to give you updates on 2 regulatory activities. You should have received a handout from George with some additional materials. So the first regulatory action is a fast track project that we've discussed over the last maybe year or so. The fast track rulemaking process is designed for changes that are expected to be non-controversial. This package updates and clarifies some requirements in the regulations for the Public Guardian Program. In some cases, it aligns with the Code of Virginia that has since been changed. You can read more about that by clicking the hyperlink in your document. But I did want to let you know that the fast track is under review right now with the Secretary of Health and Human Resources. In the fall, the Department of Planning and Budget conducted an economic impact analysis and a policy analysis. The policy analysis remains Governor's confidential working papers, but the EIA, the economic impact analysis, is published. In that, DPB concluded that there was no significant cost to the proposed changes, which is good and what the department was hoping to hear and expected to hear.
Charlotte,
as we're required to do.
Charlotte, can I interrupt you for a second? Captioner, okay, we're back. Sorry, the captions were going in the chat. Apologies.
Oh, okay. All right, so the DPB conducted their economic impact analysis, and as required, DARS has to file an agency response to that EIA, and DARS concurred with DPB's findings. You can read more about the package on the Town Hall website by clicking the link. The second regulatory activity is a periodic review of the chapter. This is required every 4 years. So we conducted a periodic review in the fall as well. And during that 21-day public comment period, DARS did receive 1 comment. This comment was provided by Joanna Wise Barnes with Service Source. In her comment, she requests that general funding be appropriated, or general funding be expanded to include funding for capacity evaluations by licensed professionals to document an individual's incapacity, and that there is not funding for this right now. And the commenter also expressed support for Senate Bill 585 related to supported decision making. As required, following that public comment period, DARS filed a report of findings for the periodic review. That included our agency's response to the public comment. In that response, we noted that funding for capacity evaluations is actually under the purview of licensing regulations with DBHDS, and we provided this comment to the regulatory coordinator over at DBHDS, and so that's beyond the scope, as well as legislation is handled by the General Assembly, and we are just discussing regulations at this time as an agency. So that you can read as well. In the report of findings, we also concluded that the chapter would need to be amended. This is a separate endeavor than the fast track package. The fast track is more viewed as cleanup. These potential amendments coming down the pike would be more substantive in nature. DARS is working now internally on a notice of intended regulatory action, which is called a NORA. That should be filed in the coming weeks, and that will start the standard rulemaking process. After the NORA undergoes an executive review, it will be published for a 30-day public comment period, and we will keep you informed about the status of that NORA and the public comment period, as well as any subsequent actions related to proposed regulations or final regulations that come out of that. You can read more about that also on Town Hall, and the links are in the document. If there are any questions, I'm happy to answer those at this time.
Charlotte, I have a question. Yeah, I wondered, and as a new member of the board, what is the role of the board in this regulatory process? I know that we're supposed to advise DARS and so on, and so where does our advice come in this process?
Okay, so with the fast track, we did consult the department with the changes. We shared those both in a separate meeting with the providers and at a public guardian board meeting in 2020, I believe. And then for the subsequent rulemaking out of the periodic review and the NORA, we will also be consulting with the board on any proposed changes that we are intending to move forward. Well, we will probably be doing that within the quarterly board meetings that you've already have planned.
Thank you.
Thank you all.
Charlotte, thank you so much for your time, and we appreciate it. Erica, I think what the best way to identify what our role is and the advice is, once we're briefed, the board is briefed on changes, regulatory changes, or potential regulatory changes, we pretty much make our comments and they're passed on by either Charlotte or others who are part of DARS. So we do get a chance to make our comments, and any advice that we have for changes in those regulations or proposed regulations are made at that time. I hope that helps.
Yeah,
Patty, I think we're back to you. And Charlotte, I want to apologize again for not for missing you on my agenda.
No worries at all. Thank you.
Thank you. Patty, your turn.
Okay, let me see if I can share my screen here. Whoops. Okay. Here we go. So, good morning, everyone. I'm really glad to have an opportunity to discuss the new PGP contract revision project that we have going on. There's a lot of material to get through, so I'm going to ask that you put any questions you have in the chat box or hold them till the end so we can get through it all. So let me get started. The existing contract is a detailed one-year contract with 4 one-year renewal periods. We're at the end of this 5-year cycle and need a new base contract to go into effect on July 1. The existing contract, although it's been in effect since July 1, 2016, that form has been in use for many, many, many years. DARS has been working hard as an agency to review the contract. The work group includes members from our fiscal, policy, and monitoring units, as well as management from the Division of Community Living. We've decided that many provisions of the existing contract can be deleted and that we need new provisions that reflect our current practices and clear up some ambiguities. Our goal has not been to dramatically change operations, but to tidy things up and to try to bring some consistency in areas where we see programs doing different things. For example, the new contract will ensure that client records include progress notes, add provisions to better separate public and private guardianship programs operated by the contractors, clarify service areas, clarify how the client to staff ratio is calculated, provide new procedures for how the unrestricted wait list is maintained, and simplify the payment process while ensuring that DARS understands how funds are being spent. I want to begin by talking about the client to staff ratio changes and the new wait list policy, because these are the most complex. First, the client to staff ratio. Our regulations say that each public guardian program will maintain a direct service ratio of clients to paid staff that does not exceed the department's established ideal ratio of 20 incapacitated persons to every 1 paid full-time staff person. This ratio is a hallmark and strength of the Virginia Public Guardian Program. It assures that local PGP staff have the time needed to build a relationship with their clients and the client's third-party service providers. It's foundational for person-centered decision-making. But there's been a lot of ambiguity around this regulation. For example, what do we mean by direct services? What do we mean by full-time? Does full-time mean full-time to the contractor, or does full-time mean full-time to the contractor's PGP operations? Our contractors have been interpreting this differently. Some understand it to mean that no guardian representative should have a caseload in excess of 20. Others argue that the measurement should be focused at the program level, not the individual guardian rep level, and that the ratio should be calculated by dividing all direct service staff by the number of public clients. This allows some flexibility to adjust caseloads based on staff consideration, such as a particular staff member's expertise or on the geographic location of clients. It's driven by client management and operational factors that differ from program to program and over time, and it gives contractors flexibility while keeping the overall ratio low. Other contractors have wanted to interpret the regulation even more broadly to mean that any person who is employed full-time by the contractor and who provides any level of direct services to any public client should be counted toward the ratio. DARS is opting for the middle approach. In the new contract, direct services are defined for the first time. They will be defined as services that require the employee to be engaged directly with public clients and their third-party service providers. We've also defined guardian representative, and that is a paid employee of the contractor assigned to work with the contractor's local PGP, managing a public client caseload, and whose job responsibilities include making monthly face-to-face in-person visits, overseeing client benefits and services, consulting with supervisory staff at the contractor and with third-party service providers to ensure client needs are met, and serving as an agent of the contractor with respect to legal decision-making on behalf of the clients. We've also explained that subject to some exception, full-time will be limited to full-time employees of the contractor assigned exclusively to the contractor's PGP operations to provide direct services to public clients. The new contract will explain that the client-to-staff ratio should be calculated by dividing the number of public clients by the number of employees allocated to work exclusively in the contractor's PGP operations, providing direct services to public clients. The quotient resulting from this calculation represents the number of public clients served to every one full-time direct service staff member. In most cases, the only staff counted toward the ratio will be the program director and the guardian representatives. If the contractor thinks someone else should be counted, the contractor will need to get DAR's approval. One complication is how to count the program director. As programs grow, they tend to ask program directors to serve as guardian representative to only a few clients. In our smaller, less well-funded program directors are doing double duty. We've decided that in most cases, it is appropriate to count the program director as a full-time direct service staff member for the purposes of calculating the ratio. This is because program directors are required to work full-time for the local PGP, not just for the contractor. And all the work they do benefits all public clients. We have added a provision to the contract that says that the program director for any contractor with 40 or more public slots can't also serve as the primary guardian representative for more than 15 public clients. A program director's responsibilities are different from those of a guardian representative and include oversight of the program, being the liaison with DARS, completing DARS reporting, overseeing referrals, working with the multidisciplinary panel, and generally acting as the problem solver on difficult cases. To say that a program director must carry a full caseload of 20 and also perform the duties of a program director undermines both the purpose of the client-to-staff ratio and the important role of the program director. DARS also has decided that in some limited circumstances, it will be appropriate to allow the use of part-time staff. In these circumstances, part-time could be a standalone part-time employee hired to work exclusively in the contractor's PGP operations, or a full-time employee of the contractor assigned to perform part-time duties for the PGP. The new contract provides that one part-time staff person can be used to cover any tail piece or remainder if the number of public clients at the time of the calculation is not evenly divisible by 20. Additionally, one part-time staff person can be used if the contractor meets the ratio, but wants to use a part-time person to keep the program director's caseload down. So it's not, you can have two part-time people, one to do one job and one to do the other. We're thinking about one part-time person here. If the contractor wants to count more than one part-time direct service employee toward the client-to-staff ratio, the contractor must provide a staffing plan for DAR's approval, explaining how the part-time staff members will be used, why it's necessary to use part-time staff members rather than full-time staff members, and the methodology the contractor proposes to use in determining how the part-time staff members will be counted toward the ratio. Now, many social service organizations are familiar with the concept of full-time equivalency, and I want to say that DARS will cautiously consider a proposal to use this system, but it is not the preferred system. Now I'd like to talk about the new requirements for the unrestricted wait list and also how the multidisciplinaries panel consideration of referrals for open slots will work. First, with respect to the unrestricted wait list, DARS is addressing this process to provide uniformity and consistency. DARS is frequently asked how many people are on the unrestricted wait list across the state. Because the providers manage their wait lists differently, the compiled number is misleading and we don't like to use it. We also want to provide a system that ensures that everyone has an equal chance for consideration for an open slot. We don't want a preferential system that gives some referred individuals an advantage. We don't want a system that gives a preference to squeaky wheels, effective advocates, or providers who have developed a strong working relationship with the contractor. We want to ensure that we're not only taking high acuity referrals. Some of our programs are using a locally developed acuity scale to determine who from the waiting list will get the next open slot. While DARS understands and admires the effort, selecting for high acuity can burn out our providers. It keeps others who also need a guardian, but perhaps in a less urgent way, from being considered. And finally, there often is a subjective element to acuity. We want to ensure that cases in which DSS is acting as guardian can be considered for public guardianship slots. DSS can be appointed as a temporary guardian in an emergency situation under the section of the code dealing with abuse and neglect. This guardianship is not supposed to last more than 20 days, but once a court has found a person to be incapacitated, it is reluctant to remove the DSS guardian. DSS referrals often have not progressed in the public guardian program because of the requirement that there be no one else to act as the guardian. We wanted to be clear that if DSS is the guardian, that should not preclude someone from consideration for a public guardian slot. Finally, we're trying to create a system so that contractors who also operate private guardianship programs can obtain slots for private clients who are qualified for public guardianship without creating a conflict of interest or giving preferential treatment to those private clients. If a contractor is acting as someone's private guardian, even if the contractor is doing it for free and the private client is clearly incapacitated and indigent, transferring that client into a public slot will always be a benefit to the contractor, leaving the contractor and DARS vulnerable to complaints that there is a conflict of interest. What we've tried to do is develop a system that's so that individuals who are privately being served by a contractor can come onto the public role, but they do so in a way that's fair and not preferential.
Patty, can I interrupt with a question?
Yes.
Question is from Rose Palmer. Is there to be a number certain for part-time personnel? Should there be a limit to how many clients can be served by a part-time employee based on number of hours, perhaps?
With the one, we will require we will require time submissions. That one client, that one employee will need to keep time records, and they'll provide copies to DARS at some regular interval. And we we will make sure that they are providing enough hours, they're working enough hours to serve the number of clients they're assigned to serve. So that's where we'll be kind of applying a full-time equivalency concept. So back to the wait list. The new contract will allow each local PGP to continue to maintain its own unrestricted wait list. In other words, they don't get the referrals from DARS, they get them from the community, and we don't oversee that. But the unrestricted wait list will be organized in date order, in most cases based on the date a substantially completed referral form is received. All referrals will be pre-screened by the program director to identify individuals who obviously are not going to meet the criteria for public guardianship. And individuals will be considered for open unrestricted slots in date order, with those who have been waiting the longest considered first. Sorry, got behind. So the steps in the pre-screening process are that when the program director, who's the one who pre-screens the referrals, gets a referral in, they'll look at the referral to make sure that the person appears to be unable to adequately care for him or herself, is indigent, and without another proper or suitable person or entity willing or able to serve as the guardian. What they're looking for are the obvious things. They're looking for the real outliers here that they can just screen out easily. Ambiguity should be resolved in favor of adding the person to the wait list. And if the program director decides that the person should not be added to the wait list, the contractor must keep a copy of the referral and a written explanation of why the referred person was not added. And they'll have to keep that for 5 years. The screening criteria in clause C above is where it gets tricky. This says that a referred person shouldn't be considered for a slot if there is some other proper or suitable person willing and able to be the guardian. This has caused confusion. If someone has an existing guardian who's not willing to continue, such as an aging or unhealthy family member or a DSS office, which was never really supposed to serve for more than 20 days. This requirement has sometimes been applied to keep the referred person from being considered for public guardianship. The logic is that the existing guardian must first go to court and be removed, then the incapacitated person can be added to the wait list and considered for a public guardianship slot. But this would leave the incapacitated person without a guardian for a period of time. This is obviously circular and unworkable. A court is not going to remove an existing guardian without a new one ready to step in. And typically, in the real world, an existing guardian would be removed and a new guardian should be appointed at the very same court hearing. So when our program directors are pre-screening, or the multidisciplinary panel is looking at a new referral, they will sometimes use this to say, oh, there's an existing guardian, out you go, you can't be considered anymore. But there can be good reasons why that existing guardian needs to be removed. They are clearly unwilling to serve, they're aging, whatever the reason is, it was DSS. And so we're trying to deal with that complication. DAR's new contract will say that the program director should not screen a person out solely because the referred individual has an existing guardian. If the existing guardian is not receiving compensation or is being compensated from the referred individual's assets, or is being compensated by a local DSS office, then the referred person may still go on the unrestricted waiting list if they meet the rest of if they aren't screened out for some other reason. If a local DSS office or an employee of a local DSS office is the referred person's guardian, the person also may go on the unrestricted wait list, assuming there aren't any other reasons to exclude them. However, and this is an important clarification, if the contractor is serving as the private guardian and is receiving compensation from a source other than the client's assets or a local DSS office, the private client may not go on the unrestricted waiting list until the compensation ends.
Patty, can I break in again? There's a question from Lindsay Pickrell. Is it possible that some guardian reps are serving public guardian clients and as a private guardian for other clients? And if so, would that affect the ratio for PGP clients?
Yes, Lindsay, we've tried to address that, and I'll go over it a little bit later. We have a lot of things in the contract now that are designed to separate public and private guardianship. The one part-time person that we allow to cover the tail piece or to reduce the ratio, which would be somebody we would expect to be serving something like 10 hours a week, 20 hours a week and serving 10 clients, no more. That person, because the people is likely to have some private clients as well as public clients, but right now we anticipate that that is the only person that would be filling both roles. Generally, we have lots of provisions here that are designed to separate public and private guardianship and to keep them from being operated as one unified program, because that has been a growing issue for us. I hope that answers your question, and if you have more at the end, let me know. Let's see. So the next step is to create a clear process for how referrals for open slots should be considered. The new contract will provide that open unrestricted slots should be filled from the unrestricted wait list in date order, with the referred individual who has been on the list the longest considered first. So you all probably recall that the code requires that each local program have a multidisciplinary panel in place to screen referrals to ensure that guardianship is appropriate and is the least restrictive alternative. DARS has interpreted this to require that the MDP will review new referrals for eligibility using criteria set forth in the regulations before the person is offered an open slot. The new contract will clarify that based on its review, the MDP may take one of the four following actions. It can determine that the referred person is ineligible for PGP services. It can conclude that the referred individual is eligible for public guardianship services with the contractor and recommend that the referred person be offered a slot. Or it can recommend that the contractor conditionally offer an open slot to the referred person because the MDP is unable to determine whether the person meets the necessary criteria. Or it can table consideration of the referral for not more than 60 calendar days. And we've provided that 60-day limitation because since we're going in date order one by one, we need to have decisions made about the person who's come to the top of the list and not hold a slot open for too long. So the procedures in the contract, here's a little table that sort of outlines what's going on. The contract provides more detail. But so in the first line, the MDP action is that they've decided that the MDP has decided that the referred person is not eligible for local PGP services. In that case, the contractor may not offer a slot to the referred person. In the second scenario, the MDP has decided that the referred person is eligible for local PGP services and has recommended that they be offered a slot in the open slot in the program. In this case, the contractor may either agree with the MDP and extend an offer, or using specified procedures, decline to follow the MDP's recommendation. In the third scenario, the MDP has recommended that the person conditionally be offered a slot, and that we seek more court guidance on whether all of the criteria are satisfied. And in this case, again, the contractor may either agree with the MDP and extend a conditional offer, or using specified procedures, decline to follow the recommendation. Finally, the MDP can table consideration of the referral. And in that case, the contractor will assist the MDP in gathering whatever additional information they need to make the decision. As a protection, if a contractor declines to offer a slot to a person the MDP has recommended for an open slot, the contractor staff must promptly notify the MDP of its decision and provide a written explanation of why it has decided not to follow the recommendation of the MDP, and allow the MDP 10 business days to respond to the contractor's decision, during which period the local PGP staff will engage in a discussion with the MDP regarding the issues affecting the referral. If at the end of this period, the contractor still declines to offer the referred individual a slot, the contractor must notify the MDP in writing of its decision. If the MDP has recommended a conditional offer and the contractor agrees with the recommendation, the program director will notify the attorneys involved with the incapacity guardianship case of the issues that are of concern to the MDP and request that the court specifically consider and rule on those issues when it evaluates the referred individual's eligibility for public guardianship under 64.2-2010. And finally, anyone who is screened out during the pre-screening process or who is rejected by the MDP or by the contractor following MDP review may reapply for a slot in the future. So So let me pause. Does anybody have questions about that?
Good morning, Patty. This is Ming. I have one comment and one question for you.
Yes, sir.
I want to shout out that you did a great job on the webinar recently on the guardianship and protection of individual, and thank you so much for that. And the question is regarding the public guardian program, 20:1 ratio. Have we ever do any analysis on workload on that one? You know, one person take care of 20. Do you think it's too much or too little, or maybe that effective to have people? Have we ever done any analysis on that? Over.
That's a great question. Not during my time. That's been in the regulation for a long time, 20:1, and we have talked to some members of the advisory board about it who are greatly in favor of it. But what the programs say and what I see is that the reason they don't want to set it at most of them do not like setting it at the guardian rep level to say no more than 20, is that you could have a situation where you have you give one of your very experienced guardian reps 10 cases instead of 20 cases, but you do that because the clients they are handling are so difficult or there are so many issues surrounding them. Mm-hmm. And right now we get some exceedingly difficult clients who are suffering with chronic mental illness, debilitative mental illness, and there are many, many issues surrounding those cases. Sometimes that can be complicated with an intellectual diagnosis of intellectual disability. And those cases require an enormous amount of time and effort on behalf of the guardian rep. So the programs prefer to keep the caseloads of the people who are handling those very difficult clients low, and they'd like to see them handled by their more experienced people. Whereas they may have, a group of clients living in a couple of nursing homes with dementia who are more stable day to day. And so the idea is that, well, maybe we could give a less experienced guardian a few extra cases, so their caseload can be a little bigger. This all varies program to program, and we've opted, as the regulation did before, to measure it at the program level rather than the individual guardian representative level, because we can't make a rule for that. I can't plan for what happens on the ground and what every need might be. So we trust the programs to be able to manage this in a reasonable way. Now, that said, there is a potential for abuse here. And really, you could say, well, my program, I have 40 clients in this program and my program director is not going to have any clients to take care of. And the other guardian rep, the real guardian rep, is going to handle 40 cases. We look for that and we screen for that kind of thing. And if we saw that, I've said to them all, we might have to tighten this up and go to some sort of system where we are saying capping, setting a maximum on the number that a guardian rep can handle. But right now we'd like to leave them with that discretion. I'd say that we rarely see that kind of thing happening. And usually when it happens, it's we've caught them in a transition period where they're reallocating caseloads or something like that. But that is something we are sensitive to and we look at, and they're sensitive to it too, because obviously their employees are unhappy if they have too many cases. And if you've watched our video, you can see our programs are extremely devoted to doing a good job. So they're pretty good at self-regulating on this if they know what the rules are. So that's where we are on that.
Right.
And we will keep monitoring this to make sure that it isn't abused because, as I said, it is absolutely core to the program. When people talk about how great our program is, what they are really pleased with is how our guardian reps have a relationship with their clients. And, you know, you just can't have that if you have too many cases on your docket. So.
Absolutely. Absolutely. And from time to time, just like you say, 20 case today is not the same 20 case next year because the level of difficulty or the customer demanded differently. It's not like 1 + 1 is 2. So thank you for that.
Patty,
I wish it were. That'd be so much simpler.
Patty, this is Kathy Harkey, and I typed a question in the chat that somewhat piggybacks on that. So in relation to the 20-to-1 client-staff ratio, due to staff positive cases, has there been an increase in DAR's approval of other representatives to cover staff shortages, or have alternative means such as telehealth, if feasible, if in situations where that's even permitted, be established? And if so, have procedures for those alternatives been included or defined in this process or in process documents?
What we've tried to do, of course, if someone's just sick, that's not going to blow the client to staff ratio if you calculate it on a program-wide basis because they're still employed. Now, somebody may have to fill in for them. But we've really written this with an idea to going to a post-COVID world. We are hoping that we will be able to have face-to-face visits with our clients again. But right now we're having electronic visits with the clients. We've extended that through June 1st. Although we have encouraged the programs where they can to make face-to-face visits. So some ALFs may be open to the public. And we've emphasized the importance of those face-to-face visits where it's possible. What we've done is provide them with PPE so that they can visit safely. And they've been very creative. So that's how we're dealing with that, Kathy. Yeah. Does that answer your question?
Yes, thank you.
Or your
Patty, this is Lindsay Pickrell again.
Oh, hey, Lynn.
Hey, I was just curious. I'm assuming the answer is no, but I was wondering whether a PGP guardian rep can ever serve as a standby guardian. I know that would be difficult with just the limited slots available, but at the same time, I'm thinking of people who have aging parents, perhaps, who are currently serving as guardians, but there's no one else in the family or any other, trusted friend who could serve as guardian once something happens to the parents.
We have never gotten involved with that, Lindsay. Our caseloads we've had so many people waiting for slots. And because of the screening process, we just haven't done that.
Okay, thanks.
Patty, there was one more question from Susan Elmore about what's the difference in contractor and the PGP.
Oh, well, I'm glad you asked that question because that's been a little thorn in my side since I arrived. I know it comes from having practiced law in the corporate world too much. But when we sign contracts, we don't sign them with PGPs. Our PGPs are simply operational units of another entity. So I'll pick on Catholic Charities who are across the street. We contract with Commonwealth Catholic Charities Incorporated to be our public guardian program. They operate a program within Commonwealth Catholic Charities that's the CCC Public Guardian Program. But our contract is with CCC because CCC Public Guardian Program isn't a legal entity under the law and can't sign a contract with us. So when a court appoints a public guardian, they appoint Commonwealth Catholic Charities, Inc. They can't appoint a program. So that's why we've started focusing on the fact all of these obligations belong to our contractor, and our contractor is obligated to operate a program. So we're telling the contractor how they have to operate their program. Is that clear?
Yes, ma'am. Thank you very much.
Mm-hmm. Okay.
Patty, good morning. This is Ming again. I keep hearing about the 1,049 client slot. How do we come up with that magic number?
That is based on our appropriation language. The General Assembly gives us 4 funding categories and says with this, you need to provide approximately this many slots.
Okay.
And so we've used that as guidance, and that's how we came with the 1049.
Thank you. Copy.
Okay, so I'm not going to go over the whole contract in a lot of detail, but I do want to kind of summarize this for you so you know what all the other provisions are about. In Article 1, we have a definition section where we define all the terms that are used in the new contract. Article 2 includes representations of our contractor. These are minimal standard corporate representations in which the contractor represents that the contractor is properly organized, that it has the authority to enter into and perform the contract, and that the contract is a valid and binding agreement of the contractor, and also that the financial information they've provided to demonstrate that the contractor is a financially viable going concern is true and correct, and there hasn't been a material change since it was delivered. Article 3 covers all of our program operations. So Section 3.1 requires the contractor to operate its local PGP in accordance with the applicable provisions of the Virginia Code and the regulations promulgated thereunder and related policies issued by DARS, all of which, hold on guys, sorry, thought I had turned that down. Again, I apologize. And all of the related policies issued by DARS, and all of these things are incorporated by reference into the contract. The contractor is going to have to use its best efforts to keep the contracted number of slots filled. It includes an acknowledgement that if slots go unfilled for too long, DARS will reallocate them at the end of the 1-year performance period. It hasn't happened yet, but if we saw that a program just simply couldn't keep its slots filled, there are other providers in the state who could use those. And so we're really only committing the slots on a 1-year basis. And this is an important check on us, for us to, in case there was abuse, to move slots where they're needed at the end of each performance period. The contractor has to provide staffing 24 hours a day, 365 days a year. And this is one of our separation of public and private issues, that the contractor will not represent that any client being served by the contractor in any other capacity is receiving public guardianship services. So Section 3.2, I'm excited about this one, and we've already asked them to do this. It's getting a good response. As we've struggled with how to separate public and private guardianship, we came up with this idea. We're requiring the contractors to register a trade name for its PGP operations that includes the phrase Public Guardian Program. So we're asking that going forward, and we can only ask because courts are going to do what they're going to do, but we are asking that any new orders that are issued should include the trade name. So it might say that And of course, the trade name is registered with the SEC. So in this case, the court could appoint CCC Public Guardian Program. And to find out who that was, you'd have to go to the SCC's website and see, oh, the corporation that really is running this, operating under this trade name is Commonwealth Catholic Charities. Or it might say, the order might say, Commonwealth Catholic Charities is the public guardian doing business as CCC Public Guardian Program. So that'll be going forward. We're not going to ask them to go back to incur the expense of going back and redoing all the existing orders. But for all public clients, regardless of when the order is issued, documents should be signed by the contractor using the trade name going forward. So any care plan they sign, any consent they give, anytime they sign on behalf of the public client, they should be using the trade name. Now, I want to be really clear about this. We need this because, as I've said, the code provides that DARs may contract with entities that operate private guardianship programs, but the private and public guardian programs must be administered entirely separately. 6 of our programs are now operating private programs, and 1 more serves a few private clients when it has extra capacity. DARS has no authority over how private guardianship services are provided, even when they are provided by one of our contractors. So this provision is designed to enhance the separation between private and public programs, and at least there will be some discernible difference that the public and the court can see, that any third party can see, so they can tell whether the client is a public guardianship client or a private guardianship client. Let's see, section 3.3 covers the designated service areas and provides that the contractor will operate the local PGP in its designated service area, that it will not, without DAR's consent, accept new referrals for individuals not residing in or expected to reside in the designated service area. It includes an acknowledgement, though, that during the course of a guardianship, a client may end up being moved outside of the designated service area. And of course, in that case, the public guardian would continue to serve the person unless we can arrange a transfer to another program. That's time consuming and expensive because we have to go back to court. So usually when they place somebody outside of their service area, they just continue to see that client. And we've had to provide some flexibility with the DBH, DSMH referrals because those only 3 providers have those slots and they are tied to specific hospitals. They are not, the hospitals don't really align with our designated service areas. So we've worked out another system for dealing with those MH referrals. There are only 98 of them. Section 3.4 says that the contractor must comply with the court order establishing the guardianship. And this is because the fundamental duties of a guardian come from the court order and the related provisions of the Virginia Code. Any failure to perform under the order or any finding by a court that a contractor has breached its fiduciary duties to its client will be considered a material breach of the DARS contract. Section 3.5 does something new. Again, we've added the definition of a guardian representative. All of our programs actually use guardian representatives, although they sometimes call them by a different name. And they're all assigned a caseload to manage. And this is a wonderful system because it designates a person who is in charge, who is the first go-to person for third-party providers, who builds a relationship of trust with the client and the third-party providers. But one of our programs experimented with, instead of operating that way, they would have a team of people available to make client visits, some of whom were volunteers. The actual guardian rep was only required to make a quarterly visit with the client. And when Betty and I were monitoring, what we heard were a lot of complaints from third-party service providers. They couldn't understand who was responsible for the client. Additionally, the guardian reps didn't have the same close bond with their clients that we saw with other programs. So what we've tried to do is clarify the role of the guardian rep. Fortunately, this program heard our complaints and they kind of gave up this system. But that's what our concern is. The definition also helps us explain the ratio, so it's important. The contract also says that without DAR's consent, no employee of the contractor who participates in providing private guardianship services may serve as a guardian representative for a public client. Obviously, this is because it is confusing. So Patty Mayer is the guardian rep. I walk into the nursing home, Golden Living Nursing Home on Monday, and I'm working for a private client, and then I come back on Tuesday to see my public client. That is very confusing to the providers, and they just can't tell what the difference is. Although I will say this is a little hard for the programs, because obviously if you were operating one of these businesses, it would be in your business interest to run an integrated program. It's way more efficient. But since private guardianship and public guardianship are not the same thing, and since the code says they have to be administered separately, I just, the code was wonderfully insightful. Whoever drafted that kind of could see where we were going. And I think it's a good idea for our clients. Each client is supposed to have a face-to-face visit each calendar month, and this is part of the guardian rep's responsibilities. And then we've added that the contractor will use its best efforts to ensure that such visits are made by the client's primary guardian rep. So they're not just sending in whoever is convenient to see the client. And this is the section where we've included the limitation on the number of cases that a program director can manage. Section 3.6 is where the client to staff ratio is covered. Section 3.7 clarifies what must be kept in each client's file. Section 3.8 deals with the MDP. DARS hasn't provided much guidance as to how MDPs are supposed to operate, and there are significant differences across the state. It seemed that some basic good governance requirements were in order, and so the new contract provides that each local PGP will operate according to bylaws established collaboratively between the MDP and the contractor, and that those guidelines will address the minimum number of face-to-face meetings that the MDP will hold each year, and they can be in person or electronic. The procedures for making decisions between regular meetings. We try to expedite decision-making when we have DBHDS referrals, because it just holds up the works, and that's very important that they be able to meet between meetings to make decisions on new referrals. It'll also indicate that a quorum for meetings will be at least a majority of the MDP, that decisions will be made by majority vote of the MDP at meetings at which a quorum is present, and that employees of the contractor may not be voting members of the MDP. Section 3.9 covers the wait list. Section 3.10 sets forth some policies that we expect each contractor to write, to provide training on, and to make available to employees who work in the contractor's operations. Section 3.11 provides that the contractor will comply with the bond requirements set forth in each court order establishing a guardianship, and that the contractor will obtain specified levels of insurance. Section 3.12 covers the required regular submissions to DARS. Contractors will be required to provide quarterly reports, expenditure reports at the end of each performance period, And if the contractor wants to renew its contract at the end of the performance period, the contractor will need to provide documents confirming its financial viability, a proposed budget for the coming year, a certificate of good standing from the State Corporation Commission, and certificates of insurance. Section 3.13 covers fiscal accountability for client funds. This section requires that the contractor will have mechanisms in place to monitor each public client's financial status. And if the contractor is responsible for a client's funds, it must have the necessary staff and fiscal policies in place. Finally, it has to be bonded and insured against losses related to the handling of public clients' funds. So we handle funds. We don't usually handle funds, quite honestly. A few programs do more of it. We handle funds when we're appointed as the conservator. In most cases, the conservator's performance and integrity is monitored by the Commissioner of Accounts. Because our clients are indigent, sometimes the court will excuse us from filing reports with the Commissioner of Accounts. So this would cover that hole because no one is really checking at that point. We also can handle funds when we are the representative payee. So that would be a provider that has a separate money managing department. Our clients are never charged for this service. And theoretically, this is all monitored by Social Security, but I don't know how often they look at it. So we want to make sure that they're using good financial monitoring, financial organizational practices. And of course, even if the nursing home or the residential provider is the representative payee, we want our guardians to be aware of how they're spending the client's money. They are never, ever, ever going to catch an intentional fraud, but they will catch carelessness or if there's something just weird happening. So we ask them to do that. Section 314 covers equipment purchases. The contractor is going to have to get DAR's consent for any equipment purchases funded with state dollars of $5,000 or more. Section 315 covers records and reports. The contractor is going to have to keep books and records related to its PGP operations for a period following the termination of the program. Article 4 covers how we pay the programs. In FY 2020, DARS amended the base contract to provide a simplified payment process. It's been working really well, and so we've kept it in the new contract. This process eliminates the use of AMRs. These are documents that DARS generally uses to keep track of grant disbursements. They're based on actual expenditures during the prior month or permitted estimated expenditures for the next month. Instead, we just now divide the total contract amount into 12 equal monthly installments and pay it on a specific date each month. The idea is that DARS contracts with programs each year to provide services to a specified number of PGP clients. And if the contractor is doing that, it should receive the money that DARS has agreed to pay. There's no need for a monthly reimbursement system. DARS is able to see if the contractor isn't filling its slots, and at the end of the year will reallocate those slots to another contractor if it can't keep them filled. DARS also will receive an annual expenditure report that will show how the dollars paid to the contractor were spent. We have included protections to guard against misuse of state funds. These are that the contract will say that all money received from DARS under the contract must be allocated to and used for the operation of the PGP program. The contractor has to provide the annual actual expenditure report at the end of the year. Of course, DARS can cancel the contract with 30 days notice. DARS can, at its discretion, reallocate slots that go unfilled, and DARS does periodic on-site monitoring. And then the next sections are the audit and review of records and operations. DARS has a right to go in at any time and on site, look at their records, meet with staff, see how the program's being run. Article 6 is special terms. This covers contract renewals, how to give notice, and other sort of DARS boilerplate. And then Article 7 is the general terms, and this is what the Office of the Attorney General requires state agencies to include in state contracts. So that's the summary. Have I bored you to death? Any more questions on that?
Patty, this is Erica. First of all, I just want to commend you for this magnum opus. Really, this is an outstanding move forward in terms of uniformity and consistency and how the programs operate. And you know, I think it's going to bear fruit. So thank you for that. I just had a couple of questions. And again, since I'm new to this, I'm not sure, but you mentioned that the guardian rep would be the point person, and that certainly makes sense and sounds like a good idea. But you also mentioned the program that was using the team approach. And I know that in some other programs in some other states, the team approach can be used very fruitfully. So I wondered if the guardian rep has a chance to share cases as a regular chance to share cases as a team with others. And I know that's maybe not in the contract, but it just reminded me.
Yeah, let me tell you what we see. Some programs will always have a primary guardian rep and a secondary guardian rep, and sometimes they make visits together. So certainly nothing in this would prohibit that. Other programs are really good about having meetings as a unit. So other guardian reps hear what's going on in each case, so that if they have to fill in, they're up to speed on it. And we're concerned about the client knowing other people in the program, so that if something happens and their guardian representative can't be the one who's responding to them, they're not thrown off completely by having a stranger there talking to them. So yeah, our programs work very collaboratively among their staff to make sure that they're covered and they have the ability to do this. And we would never, ever say you can't send somebody in to make extra visits. Go ahead if you want to do that. If you want to have the guardian rep seeing them every month, and then you want to send a volunteer in to chat 2 more times a month, that's great. The programs need to be mindful that they have to be clear about how those employees are representing themselves to the third-party service providers, because they do get confused. And I liken it to a hospitalist model, you know, that we all hate it when we go to the hospital and our doctor changes from day to day because we can't tell who's making the decisions and who's on first. And it doesn't work well. We haven't seen that it works very well with guardianship either. It makes the third-party service providers absolutely frustrated. And frankly, it gives the guardian rep kind of a way to duck. They'll say, well, I didn't make that decision because I thought you were going to make that decision, and I thought that was in your court, and I'm not going to deal with it today, deal with it tomorrow when Dr. B comes on. He'll make the decision. So I really feel strongly about trying to avoid a hospitalist model for our program. And we want our guardian reps to feel ownership of the cases that they handle while they have backup from other staff members who know. And of course, these programs will all have additional staff who are in the background. One of our biggest programs has 2 really helpful staff members. They have a clinical manager who just is there to help the program director with all problem solving, and they have a quality control person. So we're not saying that those people aren't there and beneficial. We're just not sure. We have to think about whether they're direct service staff or not. You know, I think clearly what this was designed to do, the reg was designed to do, was to create guardian rep responsible for their cases and developing the relationship, and who are the face of the program to the clients they're working with.
Thanks. That makes a lot of
Is that
sense to
enough?
me. That makes a lot of sense because as you've said, and as the video says, it's that relationship that matters. So thank you.
Patty, this is Susan Elmore. And this may
Hi,
be
Susan.
this may be in some of the other terms of the contract, and I just don't know it. It may be something we require in the Commonwealth. But my question is, do we have anything in the contract that speaks to compliance with Virginians for ADA or Virginians with Disabilities Act, the ADA, or ensuring like accessible communications under any of the federal requirements, so that let's say if I'm deaf or hard of hearing and I need transcription services, that the public guardian program provides them when you're having a meeting, or if I need an ASL interpreter, is that anywhere in the contracts?
Well, Susan, we did some training on that. We had a lawyer from the Justice Department come and train on that a couple of years ago. My view for drafting this is if there's a provision of the code that applies to them, then it applies to them. It doesn't apply to them because of my contract. It applies to them because of the code. So we took it as an educational opportunity to let them know that the ADA does apply to them, and that they are going to have to comply. Of course, they are in touch with SILs. They know they've had training on how to interact with the SILs. So yes, and I have said to them, and I believe I'm not an ADA expert, but I certainly think it is very likely that every client we have comes under the protection of the ADA.
Concur. Yes. Thank you.
So they do the best they can, they do try to work with, we spent a lot of time trying with a client who was deaf, figuring out how we would get services in place and had we managed it correctly. And so we are trying to use resources that are available and to the full extent they're available.
Cool. Thank you, ma'am.
Mm-hmm. Okay, well, so our next steps, what we've been doing is we had one presentation to our programs on the client to staff ratio. This week, we're going to be talking to them about the wait list, the unrestricted wait list. And I'll say something about that in a minute. We're also going to need to submit this contract to the Attorney General's office for a review. So that's where we are in the process. So it's a draft, it's ongoing. If people have concerns, I'm certainly happy to talk with them about it. I'm surprised none of you said why just the unrestricted wait list. What about the DBHDS slots? And so let me just provide some quick clarification on that. None of our programs maintain a wait list for the DBHDS slots. Our deal with DBHDS is they send the referrals to DARS. DARS assigns them to the local programs. Because we had a lot of confusion about who was on the wait list when local programs were trying to maintain their own wait list for those slots, we just send them the name when we see they have an opening. So when they get a name from us, from somebody who's on the DBHDS ID wait list, which we maintain in conjunction with DBHDS, we know they have an open slot. So that slot is available to be filled immediately. And we give them one person to look at. And that is it. Thank you guys for being such patient listeners and for all the kind remarks. This has been a big job, and I'm so grateful that we have such a good staff here at DARS to help with this, because it's a job.
Really, thank you a lot, Patty. That is phenomenal. I know over the years we've talked a lot about how people understand or don't understand our ratios and the way the program expects and what the code actually expects of us and of them. So I really do appreciate this, and I'm glad we've got this, hopefully, new contract going into play very soon.
Thank you.
And I really do thank you for your time because that was a lot of work. We have other business. And there may be other business that I don't know about, but my other business is the nominating committee that needs to be appointed. We have 3 members, and I would normally appoint 1, and 2 members are elected by the board. However, I haven't had the opportunity, because we're doing this all electronically, to talk to individuals about whether or not they're willing to sit on the board, on the committee, I'm sorry, on the appointing committee, nominating committee. Last year, James Allman, Angie Fallon, and Latroy Roxburgh said on the nominating committee. The meeting is proposed to be held at 9 a.m. on June 22nd, immediately before the next board meeting. This committee is going to be very important because we have people who are falling off the board this year, including myself. I come off in September. So we do need to look at that with a great deal of importance. And if Mr. Allman is willing to sit on this committee again, I would really appreciate it if he would. Are you willing, Mr. Allman?
Yes. When does my term expire?
I don't have it in front of me. George, do you have that information close by? I know we have a chart somewhere.
I have you expiring June 30th next year, 2022. Development.
All right. Well, I would be willing to. I'd be willing to serve on the nominating committee.
Thank you, sir. I appreciate that. Mr. Allman is my appointment. Can I have recommendations from the board for the other 2?
Angie Phelan put in chat that she'd be happy to participate.
Thank you, Angie. Anyone else willing to set up?
Would be happy to help. I think I did it 2 years ago. So unless that would bar me from doing it again, I'd be happy to help with this.
It does not. So can we have a vote? Oh, excuse me, I guess we need a motion. A motion to appoint the nominating committee as stated, Mr. Allman and Ms. Phelan, and I'm sorry, the name of the third party?
Monica Caravanek.
Thank you, Monica. I didn't see the name flash up. Do we have a motion to appoint these 3 individuals for our nominating committee?
This is George McAndrews. I move the nomination for their appointment.
Thank you. Do we have a second?
This is Erica Wood. I second that.
Thank you. George, would you do the honors of the roll call?
I will. Thank you. James Allman.
Yay.
Betty Doherty.
Yay.
Susan Elmore.
Yay.
Kathy Harkey. Kimberly King.
Yay.
Monica Caravanek.
Yay.
George McAndrews.
Yes.
Rose Palmer.
Yay.
Angie Phelan.
Yay.
Lindsay Pickrell.
Yay.
Tara Ragland. Troy Roxburgh.
Yay.
Ming Trong.
Yay.
Erica Wood.
Yay.
Christy Zed.
Yay.
Okay. Looks like Tara Ragland has dropped off. So the ayes have it. And
I wonder if Monica would like to, would agree to be the chair of that. I would appreciate it. Not being the chair. And she has experience, so I would like to make that request.
I would be happy to, as long as someone that's chaired it before can be a point of contact to make sure that I'm doing it correctly.
I think that the meeting is going to be right before the next meeting of the advisory board, so that will, George, I know, will help us with the details.
Absolutely. And Judge Ullman, you're a former chair as well, so I'm sure you'll be able to pick us off as well.
Good to help.
Thank you.
Having sat on that committee myself, it's fairly informal, and we hopefully will have either volunteers willing to step up, or people will have already been contacted. George, if you would tell us what agencies or at-large positions will be open for new appointments.
So actually the only person rotating off this year. So Rose, I have you as rotating off next year.
Ah, okay. Yay, I get one more year. I thought I was coming up.
So the only person finishing up this year is Angie Phelan.
Okay.
So we'll need a new rep from D4A, unless, yeah, because this is your second term, Angie, I believe.
Can you repeat what, I'm sorry, just to make sure I know what seat you hold, Angie? I didn't catch that, George.
The area agencies on aging. Yeah, I'm sorry.
She's not on the, I guess then we're reappointing the president and the the chair and the vice chair for the board. George, is that correct?
That's correct.
Okay. And I guess what I'm thinking is I think I'm at the end of my ability to serve as chair, correct?
You've had two terms in a row, so yes.
Yes, okay. So I am coming up. So I'll be on the board, but I won't be able to serve as chair.
Correct.
What has happened in the past is the vice chair has moved up to the chair position, but that's not a requirement. I don't know if there's any volunteers that want to step up or to be considered. If anyone would like to further discuss that, you can reach out to myself or to George and we can go from there. Is there any other new business or old business to be considered before we discuss the future meeting dates?
Yes, this is Erica. I saw in the bylaws that there is a legislative committee, and I understand it hasn't been meeting for a while, but I do serve on the Commonwealth Council on Aging. I serve as chair of the legislative committee, so I kind of have that orientation and would be glad to serve if such a committee were to be reinstated and under the bylaws.
I don't think the new bylaws are going to offset that committee, and I think that it would probably be helpful. It just needs to come up to the board to determine whether or not we want to reestablish that committee. I think it would be helpful. I think the keeping up with and having someone else besides Charlotte help required to keep us updated on that as well. what is the rest of the
Yeah,
board?
I agree that there should be one.
So can we?
This is George. Rose, may I suggest that we appoint that following the adoption of the new bylaws, because that will change the composition, reduce the numbers from 7 to 5.
I was about to say the
Make it
same
easier
thing.
to constitute.
I was about to say the same thing, George.
And then the goal would be to have that legislative committee meet sometime between the June and September meetings, which would give ample time to develop a platform to present to the board prior to the completion of the biannual report.
Perfect. That's exactly what I was thinking. Thank you, George. Is there any other business? If not, our upcoming meeting dates are June 22nd, September 21st, and November 9th. And I want to thank everyone for their time today and their consideration of all of the work that Patty came in and put in and that Charlotte has presented us with. And I really appreciate all of it. I do want to note the tribute to the former DARS commissioner in our minutes, if George would and Cecily would take care of that.
Absolutely.
Thank you. And I would like to adjourn the meeting.
Okay.
I need a motion.
Thank you, Rose.
Motion to adjourn.
Second.
Thank you. Do we need a roll call?
No, I think everybody's probably ready to adjourn.
But I really do appreciate everyone. Thank you so much. Bye-bye.
Right, goodbye.
Bye.
Thank you.